Hello and welcome to another episode of My Grandma Also Know. My name is Steve. I'm your host for this episode, and in every episode we invite a doctor to debunk myths, answer everyday medical questions and misconceptions. Let's welcome consultant gastroenterologist Dr. Benjamin Yip from Alpha Digestive and Liver Center.
Hello.
Please tell us more as a gastroenterologist, what do you deal with on a daily basis?
So a gastroenterologist deals with the digestive tract.
Okay, this is very cheap. Mr. George. Doctor, maybe you can explain what are all the different systems we are seeing?
Okay, the parts in green are the biliary system, so the bile ducts, right? So it actually starts from the liver. The small bile ducts will join the gallbladder duct into the main bile duct, and this is the biliary system. The pancreatic system is here and is very closely associated because they open up in the same area in the second part of the small intestine.
Before we begin, our producers have prepared some challenges for you. Let's do it, Dr. Yip.
Bring it on, man. No.
Okay lah, lai lah.
In this episode of My Grandma Also Know, Dr. Yip's challenge is to answer our digestive health-related questions within 30 seconds. Otherwise, Dr. Yip has to play a specially prepared game called Down the Gut, where he has to maneuver the ball through a digestive system that consists of good and bad holes with food he has to consume later on. Dr. Yip will also have to explain why each item is good or bad for gut health before consuming it. Good luck, Dr. Yip.
So, Dr. Yip, you say that you do stomach and biliary issues. So now we will start with the stomach issue first. Begin, Okay. What is the difference between gastroscopy and colonoscopy?
So gastroscopy checks the stomach, whereas colonoscopy checks the large intestine.
Will eating spicy food be damaging to my stomach?
Yes and no. For people with a sensitive stomach, spicy food may cause discomfort, but for those who can tolerate, it's not a problem.
Can lactose intolerance be cured?
Lactose intolerant can be treated with lactase, as in you take the enzyme as a pill, or if you cut down on your lactose.
What is the difference between prebiotics and probiotics?
So probiotics are the good bacteria that your intestines like, whereas the prebiotics are substances which enable the probiotics to grow properly.
Okay, now it's Hokkien time. Does lemon water in the morning cause acid reflux? Lai, Kin Tampo.
檸檬水啊，
柠檬水。
檸檬水是有啦，有迄个胃酸咯。
In the morning
會使呀，會使倒流嘅。
Then at night 呢？
那嘛是香啦，
是香啦。
咩路？
That means 啲檸檬水是無好嘅啦，對啦，啦。So why are some people gassier than others?
Well, some people have a sensitive stomach or intestines, so inherently produce more gas already. So like sensitive to the acid, or your intestinal organisms may produce more acid naturally.
Like for example, for me, how do I know whether I'm gassier than others?
If you burp a lot, or if you bloated, or the gas goes down the other way, you have flatulence a lot, then you know you're probably gassier than
I don't have flatulence a lot. Okay, so I put,
Okay. Oh.
Okay, I had a poop.
So this is a Korean cup noodle, I believe. So it's not so good for your digestive health because it's processed food and has a high salt content. And I think overall, you shouldn't be eating this. And I do believe the noodles are deep fried, so a lot of oil as well. So it makes you put on weight.
But I like it.
Well, I think if your stomach intestines are sensitive, then if it's spicier, then you may have symptoms like pain and bloating. But it's quite tasty.
So now we will start with the biliary issues. What does Ibuprofen do to the gut and liver?
Ibuprofen is a non-steroidal anti-inflammatory drug, so it can cause ulcers in the stomach and intestines. But liver-wise, it can also cause liver damage.
Will alcohol lead to liver cancer?
Yes, if you take too much alcohol, it causes liver cirrhosis, and that can cause cancer.
How much is a lot?
More than 3 units per day for men and 2 units per day for women.
What do you mean by units?
Standard units. Please Google.
Okay, peel.
So these are small cup of nuts and seeds. So generally they're quite good for health because it contains fiber. So for those who are constipated, it helps you move your bowels and has relatively less calories.
Every time talk about lose weight. How come you can survive without a gallbladder?
Because the liver produces bile, same as the gallbladder, and the liver is much bigger.
What's the function of a bowel?
Function of bile is to digest fats mainly in the intestine.
Do you gain weight or lose weight after gallbladder removal?
It should be a weight neutral surgery, so you neither gain nor lose.
Yeah, lor, this one who. But I thought you said no bowel to digest the fat.
Yeah, because the liver does the same thing. So actually, eventually the body will adapt and get used to it without the gallbladder.
Actually, I'm very interested about this. Will I get cancer from eating burnt food?
Yes, so burnt food, there are some chemicals which are carcinogens or cancer for eating burnt food can cause cancer.
So that means those who go for a buffet have to be careful. The most burnt
barbecue, like bakwa, Chinese New Year.
I just had 3 pieces of burnt bakwa because my wife overburned it. But very nice, it's very chewy. Wow, this one also cheap. So what's the pancreas for?
Pancreas got 2 functions. One is to produce insulin to control blood sugar, and the other is to produce digestive enzymes to digest food.
Other than surgery and chemo, what are the other treatment options for liver cancer?
Actually, liver cancer treatment can be divided into curative as in cure and palliative as in to prolong life. So the curative treatment examples are surgery like you said, and also ablative means you burn off the tumor using say radiofrequency ablation. And then there are the palliative ones which prolong life. It includes chemotherapy, which is local, as in you burn off the blood vessels supplying the tumor, or systemic, as in you take pills or you inject chemotherapy agents into your system.
So the ablative is to actually look for a cure?
It's actually cure, because it's actually for small tumors, you actually ablate or you kill off the whole tumor.
So your specialty is in advanced endoscopy. What exactly is that?
So advanced endoscopy refers to endoscopy beyond the usual gastroscopy and colonoscopy.
What about?
So endoscopy ultrasound is actually an endoscope that's fitted with the ultrasound, and you can actually examine the organs along the digestive tract, like the pancreas or even tumors that are below the surface of the stomach or the colon.
Oh.
Yeah, and then ERCP is an endoscopic technique we use to diagnose or treat biliary or pancreatic problems. Deep enteroscopy is a long scope used to examine the small intestine. As we mentioned, the small intestine is 6 meters long, and this scope can be used to diagnose or to treat pathology in the small intestine.
So why is the survival rate so low for pancreatic cancer?
Pancreas is a very deep-seated organ within the abdomen. The cancers are usually detected late, and when you have symptoms, it's usually a late presentation.
So how can we detect it early?
It is difficult. So I would say if you have symptoms relating to the pancreas, like pain, jaundice, or weight loss, then you should see a doctor.
We can do ultrasound pancreas also, right?
No, you CT or MRI. Ultrasound doesn't see the pancreas well.
Oh,
Yeah.
only CT or MRI, but it's not recommended to do it every year.
Usually not lah.
Okay, so all these things, my grandma, I don't think my grandma really know.
I think your grandma also
Yeah,
sharp.
my grandma also don't
Sleep
know.
very, your grandma.
My grandma don't do this. I aim for poop, Not hard to aim for poop. Done. Time,
We'll have one here, then you all try again.
Okay, I aim for peel, Okay. Okay, best one.
Stone. Stone.
1,
Stone.
2, 3.
Nice.
Why is HL milk bad? My wife also says it's bad. Is it bad?
I think it's obviously bad for the lactose intolerant, but I think milk per se shouldn't be that bad. And if you drink too much full cream milk, then a lot of calories, I suppose.
So why is kombucha good? It's bad for me, though.
I don't drink it, but I think it contains certain probiotics, so it's good for intestinal health.
But the concentration is less than a probiotic.
Yeah, you go for the pill one, be higher, I think.
Oh, okay. Can't just. You take the bad one, take the good one. Which is once again bad for me.
Lactose
Kombucha.
intolerant.
Sour, eh?
Is it gassy? I haven't.
Gassy.
Gassy.
You know what it takes, huh?
No.
Gassier. I'm
Is it
gassier
sweet?
than others.
Is it quite sweet?
No?
No.
I'm not representing kombucha.
Seems like piss.
Yeah. This is salty. Don't ask me why I know. So we have come to our end of the questions. So in conclusion, everyone, prevention is better than cure. Start your colonoscopy at the age of
Usually 50.
usually 50. And food is important. Careful of what you eat. So if you have any symptoms of losing weight unknowingly or what, please go and see Dr. Benjamin Yip to have a check, right? So also one more thing is that kombucha, don't try lah. Okay, just go and take your pills. Thank you for watching My Grandma Also Know. If you have any questions for Dr. Benjamin Yip or any other medical questions, please comment down below. If you enjoy watching this video, please subscribe, like, and check out our other videos here. Okay, here, yes. We'll see you in the next video. Adios, bye bye.